All right, we're going to do a quick video here just to cover some basics of billing and coding. I don't want you to spend a lot of time stressing or worrying over this because we're going to spend the next 12 months kind of refining your skills and helping you get better at this. But in general, we're going to talk about two types of coding. The first you're going to see is what we call diagnosis codes. So when you go under the assessment, you'll see that we have some diagnoses that I've added here. These codes are called ICD-10 codes. So when you search for a diagnosis code in the search box, let's add on hypothyroidism. You'll see that diagnoses come up, and it actually lists the old type of coding system, which was the ICD-9. In 2015, about 10 years ago, we switched over to ICD-10. So you'll see these are the codes we're talking about. Specifically, we're talking about a diagnosis or assessment code. You have basically two types of codes. You know, the code for the annual physical when you're doing a preventive medicine exam, a wellness exam, and then you have codes that we use for actual problems and assessments. These are diagnosis codes for medication refills, like diabetes will be E11.9. So that's the first type of code you hear us talk about. And then when you go under the billing section, which is the very last section that you'll touch on before you finish up with the patient chart, you'll see it's at the very bottom, the visit code. This is where the CPT codes, the billing codes for the office visit level will go. So if you click on this little add E&M box here, you'll see a bunch of things over here on this left column. I don't want you to worry about any of this stuff except for these top two sections. This is really the only two sections you're ever going to add. Either the E&M code, E&M services, or the preventive medicine services. So effectively, you have preventive medicine. These codes would be used along when you have a diagnosis of a physical. So if the primary diagnosis was an annual physical, then the corresponding billing code would be a preventive medicine code. We'll go to new patient. You'll see for new patients, all the preventive care codes are based on the patient's age. So you would pick the code based on how old the patient is. In a new patient or in an established patient who's already been here before, again, you'd pick the code based on the patient's age. For the evaluation and management codes, which is the E&M services, you'll see again, you have codes for established patients and new patients. And typically, these codes, we'll go through the established patient codes first. It's 99211, 99212, 99213, 99214, 99215, or a new patient, which would be a 99201, 99202, 99203, 99204, or 99205. So frequently you may hear us just kind of in short term saying, oh, that's going to be a 4, or that's going to be a 5. In general, the majority of your codes are going to be right around the 4 mark. So in established patients, you'll typically see the E&M code being a 99214. That's the most common one we're using. In a new patients, it's usually going to be a 99203 or a 99204. And so the evaluation and management codes, we use those along with problem-based visits. These are codes you use when you're not doing a physical. For example, patients coming in for med management and diabetes medication refills with labs, but it's not for their annual physical. The annual physical always goes under a preventive code, and patients get one annual physical a year. So basically, you would use one of these codes once a year with their annual physical. The other follow-up visits the patient does during the year would be an E&M code. So again, I don't want you to stress over these too much. We're going to continually talk about these over the course of your year, and you'll get better at coding. As questions arise, just bring them to our attention so we can talk about it. Thanks for watching.